Hi there, my name is Mary Savage. I'm a physical therapist and an MS specialist. I decided to talk today about balance in MS. Many individuals who have MS experience decline or changes in their balance, and that can be due to several different reasons. Many times it could be due to their vision, changes in vision, acuity, or perception that could lead to balance deficits. Changes in their sensory system, that being maybe how you feel things or perceive things, whether it's through your feet or other joints, that then obviously can change how you perceive your position, and when you're walking, that can impair your balance in some manner. Also vestibular system that we have that exists in our inner ear allows us to understand where our normal position sense is related to gravity, and that can be affected also by MS. Motor changes, that being changes in muscle strength, endurance, flexibility, potentially tone changes, whether it's too much tone, not enough tone in your muscles, that obviously can affect you when you're trying to move around and can then affect your balance. Cognitive changes in MS, those contribute to largely your attention, your focus, attention to detail, problem solving, and thus your ability to safely potentially make decisions related to your movement and thus balance. Some of these impairments can be affected directly by exercise, and some would need to have accommodations. For example, visual changes, sensory changes, many of those things can't necessarily be assisted with therapy or exercise, but maybe there's ways that accommodations could take place that would allow you to be safer. Vestibular system as well as motor, there's exercise protocols and programs that can be assistive to improving overall balance in those areas of impairment, and also cognitive, working on some strategies of how to overcome some of those impairments that may be in the cognitive field. Specifically related to exercise and the role of exercise in reducing falls in those with MS, exercise can be helpful in increasing overall endurance, increasing your muscle strength, your range of motion, and your flexibility, which will thus improve your overall safety and your balance during your gait activity. Decreasing your feelings of overall fatigue if you're feeling like you're having more endurance and muscle strength. Protecting your bone mass. Doing a form of exercise that involves weight bearing or loading your muscles and your bones actually does protect the bone density that you do have, specifically in your lower legs and limbs. Helping to manage stress and improving your overall confidence. Exercise can definitely do that, and reducing your feelings of overall depression or not having a good outlook on things. And creating an overall sense of improved well-being, and sometimes overall exercise in itself, in addition to improving balance, can also reduce pain, and sometimes that pain factor is also affecting balance, so again, they help each other. Some things to specifically think about related to balance and safety is your environment around you. So how do we prevent falls? Looking around inside of your home or your living situation and making sure that surfaces are conducive for safe walking, that there aren't significant thresholds or changes in floor levels that could maybe cause a trip or a trip hazard. Making sure that you're wearing supportive footwear. Shoes that are slip-on that don't have heel support or with heels are not a recommended shoe that provides you the most support. So wearing something that has a good lace up and a good support for your foot that's not too heavy, that you can walk around with without the footwear being a contributor to your balance being impaired. and not walking around in just socks. That's not a safe thing to do in your home. Likelihood of slipping with just the socks on. Removing rugs if possible that you might have in your home, scatter rugs. If you're opposed to doing that, at least finding a rug that has a non-skid backing to it, that it's less likely to shift on you, and minimizing those that you do have in your house. Making sure that your stairwells have handrails on them on both sides, both inside and out, and that they're well lit with lighting in case you would need to go up and down them in an emergency, or certainly at nighttime. Sometimes the stairs themselves may need some form of a visual cue, like a yellow taping or an orange taping, something that's bright that allows you to see them a little bit better so that you have good foot clearance when you're going up and down your stairs. Remembering to remove any clutter that you find is accumulating in your house. All that does is sort of narrow your pathways, and so if you end up having any sort of device, whether it's a cane or a walker that you're using, it could get caught easily on those types of things and lead to potentially a fall. Making sure that your bathroom is adequately set up in all areas. Not only does it have adequate light, oftentimes people have to use the bathroom at nighttime so that you can see and everything's safe in terms of getting in and out, that maybe you have a flashlight next to your bed so that you can see a little bit easier when you are sort of walking to the bathroom, and that in your bathroom that maybe you have some assistance, whether it's provided or that it's installed, being like grab bars for shower and toilet that make it a little bit easier and safer for you to maneuver. Maybe a shower bench or a shower chair that would, again, allow you to maybe sit during part of your shower if you have to close your eyes for hair washing and things like that. That takes away that visual input, and so there's more of a risk potentially for you to lose your balance or be dizzy in that situation. And also in the bottom of your shower or tub, that there is a non-skid mat, so that if you're getting in and out and or standing during part of your shower, that your feet do not slide out from underneath you. Making sure that when you're home, inside or out, that you do have a cell phone with you. That's in case, again, there's a fall or a mishap, that you can reach people, that they'll be able to then come and give you assistance. Outdoors, specifically in the weather, making sure that you have appropriate footwear, boots and whatnot that aren't too heavy, but they have a good grip to them when you're having to manage snow and ice situations. Making sure that your stairwells are clear of ice in the winter, that you've got some sort of salt situation so that there's less likelihood that you'll slip in that situation. And using carpet whenever possible in public buildings, just because of the fact that flooring, marble floors and whatnot, whether they're, when they get wet, certainly there's more of a likelihood that you could slip on those. So when is it appropriate to possibly consider an assistive device if you have been having trouble with your balance? You would definitely want to discuss that with your primary care physician or your neurologist. But if you're finding that you are grabbing onto things with your hands more often than you had been, or definitely all the time in your house, moving around, and that you need to have somebody pretty close when you're outside walking around, that's definitely a consideration for maybe looking at starting with a cane or possibly a walker. Again, consult with your physician on that, and that way you can be sort of steered in the right direction in terms of determining what device would be the best for you to promote your safety. If you or someone you know is struggling with their balance and or has had any falls that would put them at risk, I would encourage you to discuss that with your primary care or your neurologist, and maybe referring to physical therapy might be a recommendation, a good start to making sure that you can be safer when you're moving around and that you have the right equipment. In addition to folks that are ambulatory, meaning walking, folks that find themselves using a chair, a wheelchair of some kind, also, start at one level and then maybe there's a change in balance, seated balance. And at that point, again, recommending they seek back to their vendor that had given them their chair, and possibly there's some more support or suggestions that can be made to, again, make you safer in the chair, but continue to be as independent as possible. If you have any other further questions related to sort of the integrated approach to balance and better balance and Free from Falls program, you can check out the MS Society website, and it provides great information. Thank you for listening today, and be well.